From the Toronto Star, I'm Adrian Chung, and this matters. Like almost everyone you know, I got a dog during the pandemic. His name is Sully. He's a Nova Scotia duck-tolling retriever, a whirling, floofy ginger ball of puppy energy. He's always up for a training session or a game of tug-of-war. And he's only about 4 months old, so we're still working our way up to fetch. And he devours everything. Food, mostly, but Sully will also try to eat anything he can get his mouth on. Sticks, rocks, clothing, garbage, and other dog waste? Puppies are cute as hell, but they're a lot to handle because pet owners will know that there's no shortage of things that can make their animal sick. The wrong food, a stray piece of metal on the sidewalk, a bad houseplant, and you're not wrong, wondering as you scroll through your Instagram feed of all these new cats and dogs you're seeing. The pandemic pet boom is a real thing. According to Abacus Data research and polling, nearly 1 million Canadians got a pet during the pandemic, when they didn't have one before. More than half of all Canadians say that at least one kind of animal lives in their home. Rescue and foster groups across the country are slammed with requests. Their waiting lists are now months and sometimes years long. But with all these new pets, pet owners, and demand, what happens in an emergency? How quickly can you get medical help for your four-legged family member if they get poisoned or break a bone?
I'm being booked out a month in advance. That's never happened before. I have friends who are specialists, who are, for instance, eye specialists. For me to get an appointment with them, there's a 3-month waiting list, and one has stopped taking referrals.
That's Dr. Jory Bocknek, veterinarian for more than 20 years. He practices at a clinic north of Toronto in Aurora, and I gave him a call to hear what he and many other vets have been facing since the pandemic began, to learn what kind of pressure vets and animal patients are under right now.
We were down 10% when the lockdown first happened a year and a half ago. And we thought, wow, we're doing great. And if it stays like this, we can keep all of our staff and we'll be fine. And then the phone started to ring. And all of a sudden we looked up and we were seeing double the amount of appointments. And we were starting to book out a week in advance, 2 weeks in advance, having to do more drop-offs because people needed to be seen that day. And we were looking for another vet prior to the pandemic. A year and a half later, we can't find people. And it's not just me. It's every facet of veterinary medicine is affected.
Wow. So what's going on here? Is it that the colleges don't have enough veterinarians coming through? Obviously, there's so much demand and not enough people to fill those positions.
I would say the natural attrition of veterinarians retiring exceeds the number of veterinarians graduating. So that's happening. Pet ownership has gotten significantly larger. And it's interesting because in my lifetime, I've never walked through the Ontario Humane Society on Woodbine and seen it empty, except during this pandemic. It's now not unusual for you to have a 10 to 12 hour wait in the parking lot to get into the Emerge Clinic.
Wow.
It's like human medicine now.
I was wondering about that too with the pet owners. Understandably, some of them are probably very anxious, especially if it's a real health concern or it's been a long time since they've taken them in for a checkup. What has that relationship been like, trying to manage the owners, not just the pets?
It's managing the owners. That's the biggest challenge. I mean, we've instituted other methods, like as opposed to scheduled appointments, we've tried to increase our appointment numbers, which again, that's finite.
I don't think that there's just one solution here, but what do you think will happen in the future? Is the demand going to drop off? It doesn't sound like there is.
I don't see a fix because the colleges came out and said they're not going to increase enrollment. So if the colleges aren't going to put out more veterinarians, actually things are getting worse. Because as I said, the retirement attrition exceeds the graduates and the COVID burnout is only adding to it.
Jory, thank you so much for taking the time to do this. Really appreciate it.
Oh, you're more than welcome. It's been absolutely my pleasure.
That's Dr. Jory Bocknek, veterinarian at Abbotsford Animal Hospital in Aurora. Coming up, we're reaching out to Dr. Kwantes, the president of the Canadian Veterinary Medical Association. Beyond what's happening in the day-to-day of vet clinics, we'll talk about the bigger structural problems of the veterinary care system in Canada and the changes that need to be made to fix it. We'll be right back. Dr. Kwantes, thank you so much for your time to talk about this.
Oh, thank you so much for having me on your show, Adrian. I appreciate it.
The pandemic pet boom is pretty well documented, but how do you think this moment has changed veterinary care in Canada? Whether that's the demand side of it, the care that vets can give to each patient, how has this moment changed things?
Well, this moment is one that's superimposed on a continuous slow change as far as the availability of veterinary services in Canada, because over a number of years, there's been a growing dichotomy between the level of demand for care and the availability of care. And there's a number of reasons for that. But you're right that during the pandemic, a lot of people went out and got animals for pets. And of course, that's obvious. They make wonderful pets, wonderful companions, and lots of studies have shown that pets are great for your own mental health and well-being. But each of these pets, of course, needs routine care and emergency care. And unfortunately, too, many people made spontaneous purchase not quite aware of what all the demands of pet care might be. So now we have also pet owners that are bringing pets in for surprises because, for example, maybe didn't feed them well or train them well, or there's anxiety problems or whatever, right? So now you have a relatively tight market as far as availability of vet care with an increased demand. And unfortunately, and I hear this all across the country, and it seems to me that most veterinary clinics are experiencing something of this. We have times when we have to turn people away for care that we would rather give just because we're busy with other pet cares. For example, I had a patient come in that was sick and I had booked a half hour for it, but because of the nature of the illness and the type of intervention and therapeutics we needed to administer, it took us 2 hours. So then you're an hour and a half behind. Meanwhile, everyone else has to be a bit more patient. But you can imagine if that happens 2 or 3 times a day, and you happen to be working in a clinic, for example, where there's a shortage of staff, because that's another issue these days with COVID-related restrictions, and then the extra time that we take for disinfection and so forth. So anyway, bottom line is when you're working pretty well at capacity, it's a fine line between capacity and overwhelming.
Right. And these cases that you're talking about, I know that it depends on what kind of animal is being brought in. It's a case-by-case basis. But are you finding that some of the cases are more serious because of that delay in potentially the pet owner bringing that pet in, that they've been putting it off because of COVID, or that they weren't aware of some of the demands here?
I think both of those are true. And I'm really glad you mentioned that, because on one hand, we look and say, oh, there's a veterinary shortage. But on the other hand, there are things that pet owners can do to help their own situation and the situation of their pet, because veterinary care is always offered through a veterinary client-patient relationship. And it's a mutual caring, if you will, a collaborative. So if we have owners that really research the type of animals that they're going to get and are aware of what their needs are, including training and nutrition and space and exercise and so forth. And then once they have a pet, if they're able to arrange for preventative care ahead of time, this makes a lot of difference as far as vaccinations, which can prevent really serious illnesses and whatnot. So that in itself can prevent not only a lot of stress and expense for the owner, but also the need for emergency care at clinics. And then on top of that, if when they do see an emerging concern, they bring a pet in right away, all those things can make a big difference, not only for the animal, primarily which we're concerned about, but also for the owner as far as mental wellness and cost, and as well as for the stress on the veterinary service providers. So there's certainly things that can be done. And each of those steps, some of those are related to COVID and some of them are related to maybe not knowing, but all that will help.
The staffing crunch that so many clinics are facing, vets that are feeling burnt out, clinics that have had to cut back on hours or perhaps services. How many of these structural problems, the bigger scope things that we're talking about, how many of them existed even before the pandemic to some degree?
Well, the Canadian Veterinary Medical Association did a workforce study. The results came out during the pandemic, but the information was from prior to that. That's when the survey was done. And that already showed that there's an increasing and important shortage of veterinary providers there. That particular study showed that we need to increase our veterinary capacity by about 4.5% per year on average. Now, if you do the numbers, that means in 10 years, we need like almost 50% more. So that's a huge issue. And of course, the veterinary medicine is regulated by provinces, and many provinces have also done their own version of workforce studies. And straight across the board, every time we've seen, yes, there's a veterinary shortage. Now, when you're talking about bigger picture items, one of the things I think that we need to consider is there's demographic change over time. If you look at a veterinarian from, say, 25 or 30 years ago, it probably is a veterinarian that works 40, 50, 60 hours a week and has quite a long career and doesn't take as much time away for family reasons. Not that we're against that. We're for that, of course. Now that veterinarian might be in the career for a little bit shorter. They're working less hours per week and they're gone more for family reasons. So all those things make a big difference too, as far as how many hours per vet you might get over a course of a career, right? But there's an increasing demand for veterinary services, both because of increased numbers of households in Canada and because of increased numbers of pets.
Right. So when we're talking about maybe that attrition rate, that there are fewer vets coming into the business, then of course, every year you have vets who are also retiring. So it doesn't quite balance out the demand, the increasing demand, and the people who are leaving and coming into the business.
That's right. And certainly retention is one of the big things that CVMA wants to be working on. And the other thing that I just should point out too is that we're talking about veterinarians, but very much included in this is the registered veterinary technologists, who are very valued colleagues in our animal healthcare teams. And we're finding, not all the provinces did studies on that, but Alberta did and showed that there's just as significant a problem with retention and numbers of veterinary technologists. So every clinic I know of right now is basically looking for a vet or a technician or more.
So when you mention the provinces, though, for instance, in Ontario, they've put that cap at, I believe, 120 grads per year. Is that a potential solution that provinces have to maybe move that number up to shift with things? I know that's on a province by province basis, but is that something that needs to have a look at, that there needs to be more grads every year?
Right. Well, it's true that it is regulated, both education and veterinary medicine provincially, but it is definitely a national issue. So that's why the CVMA is concerned and looking at it, because it's interesting. Some of our three main priorities are animal welfare and national issues and the health and efficiency of our veterinary workforce. And this veterinary shortage touches on all of those. So the CVMA also talks with the veterinary schools. We have 5 accredited veterinary schools in Canada, and only one has increased the seats slightly in the recent past. And so there hasn't been much change for a long time. And definitely, we would love it to be able to use the information we have from provinces and our national survey to put pressure on governments to increase funding to the veterinary education sector so that we can graduate more veterinarians per year. Without doubt, that is going to be part of the solution. Another part of the solution, by the way, the Canadian Veterinary Medical Association has a national examining board, which is a board which evaluates credentials and experience and capabilities of veterinarians that have learned or graduated from overseas and coming to Canada.
So international vets, yeah.
Absolutely, yes. So interestingly, last year, I think about 20% of the certificate of qualifications, which the National Examining Board gives to veterinarians, which they can use to get credentialing in their province, about 20% of those actually were given to veterinarians that were trained outside of Canada. And so that's another thing that we're looking at trying to improve. There's several ways that vets trained overseas could approach the National Examining Board to become certified. And that's another effort that we're doing to try and improve the availability of veterinary services in Canada.
You mentioned that the relationship between vets and pet owners, and of course the pets too, is a mutual one, right? It's a 3-way street. And right now in this moment, of course, there is stress and anxiety for both sides and for some of the same similar reasons. There is hope here that things can get better for everyone. But if you could tell anything to both sides of what they should know at this moment, what would you tell them about how the system can improve?
Right. Well, honestly, and I often say this, we can learn a lot from the animals with which we work. And I will say this, that whereas a pet owner with a sick pet comes in and gets maybe stressed out for a number of reasons, and they can be valid, when the receiving end, the veterinary staff maybe get stressed out for a number of reasons, which may be valid, we can look at our pets and actually find out that if we can adopt the same attitude as they have, which is usually living in the moment, accepting what we have and doing the best we can, if we could all adopt that attitude, I think the whole veterinary client-patient relationship would be better. But the thing that hurts really is veterinarians want to be there, to be available when they're needed. And I've talked to a number of veterinarians in a number of different clinics to say, it sort of tears our heart out when we have an animal we know can be benefited by our care, and we have to turn it away and send it somewhere else when we don't know 100% that the care will be available there either. And that's distressing for the animal as well as the owner and the veterinarian.
Yeah, that must be such a difficult thing in the industry right now, too, because there's more demand than ever. But then vets get into this line of work because they want to provide care to these animals. That it's kind of tugging at both things that they want at the same time.
Yes, absolutely. And one thing that we would like owners to be aware of, and most owners are, most owners are great about that and patient, but when you're in a stressful situation, of course, it doesn't matter whether 99% of the pets are seen in a timely manner. If yours is the pet that isn't, then all the pets that you know don't get the care that you like, and that can be difficult. But we are definitely, as a veterinary profession, doing our best. People are putting in extra hours and caring the best we can to give what we can do for our pets. And if I may just add, we're talking mostly about pets here, but we shouldn't forget the fact that there's a tremendous amount of veterinary work on other sectors as well. Like there's more than one facet to the veterinary workforce shortage. And we have food production animal veterinarians, for example, that are very important for both animal welfare and quality and health of the food that's provided to our consumers, and international trade for that matter. That sector also has some veterinary shortages, which we find that some people in rural areas sometimes can't find a vet or have to drive for hours as opposed to a vet coming to the farm. So those things also, we can't forget about that because they're very important.
Dr. Kwantes, thank you so much for your time and to shed some light on this.
Thank you, Adrian.
And that is Dr. Louis Kwantes, the president of the Canadian Veterinary Medical Association. That's it for today. Thanks so much for listening. I'm your host, Adrian Chung. Our This Matters team is me, Adrian Chung, Brian Bradley, JP Fozo, Matt Hearn, Morgan Bocknek, Raju Mudar, Saba Aitazaz, and Sean Pattinen. Our music is by So Called, Mike DeAngelis and Sean Pattinen. We want to hear what stories matter to you. Please send us your comments, questions, or ideas to thismatters@thestar.ca. Please consider supporting the journalism the Toronto Star newsroom does at thestar.com/subscribingmatters. And don't forget to subscribe to This Matters on Apple Podcasts, Spotify, or wherever you listen to your favorite podcasts. Let's talk soon.